Thank you for listening to the Oklahoma Venture Forum podcast. I'm your host, Lindsey Miller, founder of My Marketing Assistant, and today I am joined by Randy Wall of Xoma Health, who will be in Tulsa at our March event for the Oklahoma Venture Forum. So thank you for joining me today, Randy.
My pleasure.
Yeah, so tell me the quick synopsis of Xoma Health.
Well, Soma Health, which I'm president, we've been working on a product, probably for the past year. And it's a very simple product that affects xerostomia, which is commonly called dry mouth, but it's a medical condition. And this simple device is like a mouth guard with a built-in reservoir that holds water. And it's not as simple as just pouring water into your mouth. There's a wick system, and it allows the water to imitate saliva flow, and it moisturizes your mouth during the nighttime, which right now there's no product on the market other than waking up 3, 4, 5 times a night to sip water that can hydrate the oral cavity, and we have that.
And is it just regular tap water that goes into the device?
Saliva is 99% water.
Okay.
Yes, and this is just regular water. And there's no magic to it. There's no, artificial saliva or anything. It's just water.
Yeah, it reminds us, it's like call your mother and drink more water.
There you go. There you go.
So maybe it is.
People will say, yes, put this in, and to get water in my mouth at night will be fantastic.
Yeah, and how many people does xerostomia affect?
Well, it's very interesting. Before I got into this, so you have a little dry mouth at night. You didn't realize that the fact is the medical conditions of xerostomia are staggering. You can't sleep at night. You have nightmares. You have fits and turns at night. You wake up with cracked lips, cracked tongue. You have more cavities. So it's truly incredible. And you say, okay, well, a few people have that. In the United States, 66 million people are diagnosed with xerostomia. That's a big number. 22%, or 1.8 billion people in the world, are diagnosed with xerostomia. And then in those 66 million, those are diagnoses that are different degrees. But there's a couple subsets of that. One is called Sjogren's syndrome. And there are 4 million people diagnosed in the United States with that. That's really bad stuff, because you have impaired or no saliva glands. So you are producing no saliva. And after treatment, you lose 50 to 60% of your saliva right then, and it only continues to get worse. And you go, wow, what do I do about that? And of those 4 million, 73% have severe xerostomia. And there are all kinds of products for the daytime. There are gels, there are mouthwashes, there's toothpaste, nothing at night. And of course, that's the time you want to have a restful sleep, and you don't get it. And so those 4 million are there just in the United States. That's a sub-market. Another sub-market are people that have had head and neck cancer surgery, radiation or chemotherapy along with that. And they tend to lose all of their saliva glands because of the radiation. And there are 77,000 patients that go through that treatment every year in the United States. So just think of that, 77,000, another 77,000, another 77,000. And there is not a thing for them at nighttime.
And probably just suffering through it.
We interviewed 150 patients on a project we were doing to get a better understanding. And we thought it'd be good to talk to people with xerostomia. And I'll tell you, it was an eye-opener because you just hurt for them. Let me read you two quotes that I think. This one is from a patient, and her quote kind of represents everything we heard. And she says, "Dry mouth doesn't sound bad, but it's awful to live with. It just affects every aspect of my life." Another person said, "I have tried many over-the-counter remedies and have gone through radiation. They don't work. During the day, I'm able to deal with the dry mouth by drinking water. At night, though, it's not an option, and it totally disturbs my sleep. A device like this would be life-changing." When you hear that and you think of what we're actually going to be able to do, which is improve the quality of life for millions of people, not only here in the United States, but around the world, it makes you feel very good about what you're doing. So we're very excited. Also, some of the patients, there was a survey done, and some of the patients said 25% of them said quality of sleep was their biggest concern. But 97% of these 3,600 patients that were interviewed said, "I'm looking for a better treatment for xerostomia." So it's not a small thing, it's a big thing. And here's some impact. We get up and go to work, right? Think about if you have xerostomia and you have this awful night's sleep, and that survey said 42% had to take days off work. 30% had to reduce their schedule of work. 30% had to make career changes, and 30% had to stop working altogether. It's just every way you begin to look at this, you say, how can we improve it? And I think we have the answer with, it's called Xoma Guard. And this product, it's like a mouthpiece that just fits comfortably on your upper arch. And in that mouthpiece, the top portion of it, it's like many mouthpieces on the market where you boil it and you bite into it, so it has an impression of your teeth, so it fits very comfortably in your mouth. And built into that mouthpiece is a reservoir. About a half ounce of water is all you need to go through 6 to 8 hours of sleep. And then there's a system. It's not just pouring water into the oral cavity, because that wouldn't work, because you'd aspirate it and all kinds of other problems might come about. But due to this complexity, which is patented, it allows just the right amount of water to come out of the reservoir and into the main channel, and then there are holes in the mouthpiece that allows the water to flow into your oral cavity. And that imitates the natural flow of saliva, the same amount every night. And you just pop it off, put it in a dish or a glass, and it refills very easily. You're ready for the next night. Also, a lot of people ask us, well, do you have to have a prescription? Do you have to, how do you get this? We've already completed an FDA review with our manufacturer, initial review, and this will be an OTC, inexpensive, over-the-counter product. So you go to Walmart or Walgreens, you pick it off the shelf, and you go home. Just as simple as can be. And like I said, there's really no product on the market, and we've researched it obviously very, very thoroughly, for nighttime. And there are two devices we found in the market. One's called a Sally pen, but it's a device that you put these two tongs in your mouth, and there's a handle that comes out, and you press the button, because there are batteries in there, and it electrostimulates your saliva glands. You do it only 5 to 10 times a day.
That sounds like a lot.
That sounds like a lot. And if you saw the device, you'd say, it sounds like a lot, and I'm not going to do that.
Yeah.
But the biggest problem, and we have some quotes on websites where it works for some people, it doesn't work for others. You're not going to do it at night, obviously. But also, it stimulates your saliva glands. So if you don't have saliva glands, it doesn't work.
It's exactly what I was thinking
That's
about. Yeah.
one product that's out there, and it's $250. And there's another one that you sit a device about this big on your nightstand with tubes that run out of it, and it's all run by electricity and tubes that go into your mouth. And patients look at that and go, I don't know about that. And in fact, we talked to the company and they say they sell very few of those in the market today. So you look at, those are the only two devices we found. And then the third one over here is a little mouthpiece that you take and you put in your mouth and you say, I'm hydrated.
Mm-hmm.
So we're very excited about that. And we right now, we have a distribution plan. I was CEO for 30 years of multinational pharmaceutical and medical device companies, so I have somewhat experience in taking a product to the market. In fact, one of the companies that I was brought in, and we developed. They had the technology, but they didn't have a path, and I helped them develop that path for the first ever oral dissolvable tablet. Now today, everybody knows what a dissolvable tablet is. They didn't in 1994. We invented it, and we signed a national distribution agreement with Pfizer and launched the product. And 6 years after that product was launched, 6 years, I had retired. The company sold for $500 million.
Oh, wow.
Now, why do I bring that up? Because that's kind of the model that we will be pursuing. Once we take our prototypes, we don't have to do clinical trials, but we're going to do some patient pilot study type thing, just to make sure that, what we say, what we believe is proven in an actual patient. And once that's completed, then we will go to major distributors, medical distributors like Pfizer, Church and Dwight, P&G, 3M Health. There are people that are SmithKline Glaxo, which has the #1 selling product, dry mouth product in the world, called Biotene. It's a mouthwash. So all of these would not compete with their existing products. It would augment their existing products. And we believe that'll be good product line extension for them.
Yeah.
We'll see. So our distribution path is pretty well defined on what we want to do. Our manufacturer, who we're working very closely with, and as I said earlier, we'll have our first production prototypes tomorrow, in fact, and that's going to allow Dr. Bandy and Dr. Burton to take the bench testing and run it through an actual device, and then we'll have enough of them where we'll try it on ourselves and make sure that works. Once that's done, then what we'll do is have additional production prototypes made for the pilot study, and we expect that maybe to complete the pilot study in April, May, June, something like that. And then if that all goes well, which we anticipate it will, because there's really nothing to go wrong, it's so simple, then we would start to manufacture product, and our goal is to launch this into the market in January or so of 2026.
Okay.
So it's not that far off on what we have to do, but our manufacturer is they're turnkey. They'll take it from the concept to packaging to shipping to our distributors. So we're very fortunate to have someone like that as a partner with us.
Absolutely.
The product is patented. which is good. It's simple, but it's patented, and we think that will limit competition from trying to mimic this product. So we're excited about it.
Yeah, it sounds like you have a lot of groundwork covered and a fantastic team too. So tell me a little bit about how this got started. So you're coming in here as president. Who else do you have here?
Well, it's a great team. I was kind of recruited to be a mentor at Oklahoma State University,
Mm-hmm.
and the folks running that program said, "Hey, we've got some people we want you to talk to. They're both professors of physics at OSU, but they have this medical device idea, and that's your background. Let's go have coffee and meet them." I said, "That's fine." And I did. That was in April of this year, and met them and said, "Wow, this is going to work. This makes all the sense in the world." So that's how I got involved. And then I said, well, "Where did two physics professors? Where did you come up with this idea?" And it's an excellent story because Dr. Bandy's daughter is a physician in New Jersey, and I guess it was about 5 years ago or so, she had to go through head and neck cancer surgery, and had radiation and chemotherapy, and it totally eliminated her saliva glands, and she's fairly young. So what? Well, as a physician working 5 days a week, she now works at most 3 days a week because she doesn't sleep well at night, and so it's just too much to get up and go through that kind of a day 5 days a week. And Dr. Bandy said, "I have to do something about that." And she started thinking. She went from a professor to an entrepreneur pretty quickly. And she started thinking, well, how can we do something simple, get water into the mouth at a controlled rate? And my hat goes off to her because she worked for several years on the concept and the theory, and it kept getting refined and refined and refined. And then the bench tests started to produce the results of saying you can take a mouth guard and put an internal reservoir in it that holds about a half ounce of water, and allow that water through a controlled mechanism to go into the mouthpiece, and the water's distributed through holes at a controlled rate into the oral cavity that will give you hydration for 6 to 8 hours. Every one of the 150 people we talked to in her interview said, "I'll take that in a heartbeat." They really look at this as changing their life, because if you can sleep 6 hours, 8 hours, versus an hour and a half before you are awakened because of you can't swallow,
Mm-hmm.
and you have to sip water. So that was the genesis of it, and we're very proud of what Dr. Bandy did versus just saying, "Oh, well, somebody else will come up with an idea."
Right.
She drove the idea, and we hope that it's very successful for her, and especially her daughter.
Absolutely.
And millions of other people
Right.
around the world.
Well, ask any new parent what it's like when you don't sleep and then all of a sudden you get your first night of 6 hours of sleep. I
Yes.
can't imagine sustaining that for years and years and years. Like, it would be incredibly disruptive in your life.
Well, it is, and it doesn't get better.
Yeah.
That's the thing. It's not like, well, if I do this for 2 or 3 years, I'll get back to normal. It doesn't happen that way. Once you have a diagnosed xerostomia diagnosis, you're in trouble. And that's why we call it the hidden disability, because nobody really talks about it. Even the patients don't really talk about it. They just suffer.
Right.
That's all they do. They just suffer every single night, and certainly during the day. We're focusing on the nighttime because there's no product available there. But we also know that during the day, um, you Amazon has 50 plus products that are labeled for dry mouth. The world market for just the OTC products, and this is from Grandview Research, which is very well known, is $2.7 billion. And most people say, does it work? Yeah, I do the mouthwash, and that only goes for a certain period of time. There's nothing wrong with that, but there's no device that constantly gives you hydration. And most people use those products, and most people that we've talked to say, well, during the day you can do that, and you can sip water. All the patients said, I'm never more than an arm's length away from a bottle of water. Now, would they put a mouthpiece in and have this hydration help during the day? Some are certainly going to do that. There's no question about that. So we'll just have to see how that works out. In fact, Dr. Bandy was interviewing a person, and that person said, I'm a runner. This is a great product to put in my mouth. I don't have to carry my bottle of water. There was a volleyball player that told her, oh, I could wear that and be hydrated while I'm playing the match versus, getting a drink of water. We don't know where all that will go, but it's a concept that so many people are saying, oh, I understand that.
Mm-hmm.
And maybe that could help me in other ways besides xerostomia. But our main goal is the xerostomia patients that really have the medical problem of dry mouth.
Absolutely. So you're speaking at Oklahoma Venture Forum Luncheon in March.
Yes.
And what are you asking of the community for Xoma Health right now?
Well, right now, where we are is we're raising money.
Okay.
That's and as anybody that does this, and I've done it several times. I took that oral dissolvable tablet public and did a very successful NASDAQ IPO, which is probably the most fun I've ever had.
That sounds so cool.
Yeah, it was great. And we didn't have a real product. We only had a placebo.
Oh, wow.
And we didn't have $1 in revenue.
Oh, I would love to hear that story.
And
That's
I took
fun.
it public, and we oversubscribed in 4 weeks. It can be done, and it is a great story on how can that even be possible when most people have a very hard time raising pre-seed capital.
Absolutely.
And that's where we are, and we know what we're up against, because it's not like people don't believe in the concept of the product. There are just so many venture capital firms that in their funds they say we don't fund pre-seed investments.
Yeah.
That's fine.
Right.
And there are some angels that we're talking with right now, and we'll just have to see where that goes. We've funded so far about $200,000 through grants, NSF grants, and that's the world of Dr. Bandy and Dr. Burton.
Right.
My world is equity.
Yeah.
And so it was a good mix.
I'd say good partnership.
Yeah, very good partnership. And the team, the three of us, it doesn't happen all the time where you pick 3 people and they all get along and they all really believe in what each other does. And we have fun doing this. We know that we have a tremendous opportunity to affect the world health market. We know that the initial funding, the capital structure I've put together, I think it's very rewarding for whoever's going to come in and participate in this early round, which is all in negotiation, and I'm aware of that. But we're very realistic. 100% of nothing is nothing. So I've done it for so long that I kind of know, where we probably need to go on a capital raise, and I've educated the two professors, and everybody is in lockstep of what we want to do to try to get to the next step and get this product out in the market.
So pre-seed funding is the next phase.
Yes.
And then potentially finding some other team members to continue helping you go to market, or will you stay really small and tight for a while?
We're going to, because of the structure, we'll stay pretty small and tight because our manufacturer is going to have the pallet full of product package ready to send to a medical distributor. We're not involved other than the overseeing and that. We're just so fortunate to be partnering with them that they can do everything. And I've worked with them before, so I know what they can do. And it will go off to a medical distributor, and they'll distribute it. So our role, we're not going to be involved in the supply chain. So I think we can remain a pretty tight, small company.
Yeah.
We're going to continue some R&D effort because we believe there are opportunities in the future for this type technology. As an example, what if we looked at it, people looked at it and said, oh, this could be a product that could deliver liquid medications on a controlled rate, because we can change the controlled rate depending on what the wick sizes are in that are. And again, I told you we kind of parallel the oral dissolvable tablet. The first product that came out was cough cold medicine, and we used to say to people, hey, you have a 3-year-old wakes up in the middle of the night with a cold, you come in with your bottle and your spoon, and you say, I guarantee you a couple things. You're going to spill it, you're going to over-medicate or under-medicate, and you're going to disrupt, the kid's sleep and all of that.
Yeah.
What if you took a tablet that dissolved in 5 seconds with bubblegum flavor, you popped it in his mouth, he's medicated with the exact amount. That was the first product that came out. But we also knew where we really wanted to go was putting prescription medication in there. Cancer patient, can't swallow, take a dissolvable tablet, you're medicated. So our paths with that company and Xoma Health are similar because we believe there's other uses. Are we looking at them? Have we thought about it? Not more than what I've just talked about here. But I think there are opportunities down the road, to make this a more universal product for other diagnosis.
Yeah, and I can imagine that would be interesting to funders out there to hear, is that it's not just a single use potential, that there is opportunity for other things.
I think there are. My job is to keep everybody focused on, no, let's get this first product out and make it successful. And then, just as we did with Orazolve, it was called, and then let the engineers and the scientists say, here are some other opportunities. And some we may not even know about, but if that concept is out there, it may, and I'm sure it will, trigger new ideas. So this is not a company that it's a one and done product. I believe, and I have a track record on that, so I believe it's more than that.
Yeah. So what's your vision for this business over, let's just pretend that we've launched in January of 2026. What's happening in the next 3 and 5 years?
Well, I wish I could answer that. I mean, that's hard to do. What's happening in the next 3 or 5 years? One of the things that I've done is put together a very specific, detailed financial plan, which I've done with every company. And that's one of the things I suggest all entrepreneurs do, to show what the business can really do. And we also looked at what kind of penetration of that 66 million, be realistic. What kind of numbers would an investor really look at? And I've seen entrepreneurs say, well, we're going to get 25% of the market. And you go, oh, yeah, okay.
So that's
right.
bold.
Yeah, that's very bold. And in our financial plan over the next 3 years, the highest penetration we have in our numbers is 2.4%. So we're also saying, I think there's a lot of upside to our financial projections. And at 2% penetration in 2028 gets us to about $35 million transfer price to a distributor. Is that what it's actually going to come out to be? I don't know. But because of our business structure, it's a very profitable company. Mm-hmm. If it's selling in the market, then it's very profitable to us. So we have that all laid out. We have a good idea what our cost of goods sold is. We know what it's going to cost us to get to the pilot study. We know what it's going to cost us to get to distribution. And in looking at that, you just look at this huge market. You listen to the 150 patients we've talked to and all of their problems, and it's a matter of just providing a solution. And I think we have the solution without financially going overboard and saying, okay, this will be $1 billion company. If we run, $50-60 million and the way the profits flow, I think the investors, because I have all of that laid out, are going to be, very pleased with the return. And that I'm excited about, to reward the people that take the chance, the risk. Now they should be rewarded handsomely, going forward, because we need them.
Absolutely.
Yeah.
So any other final thoughts about Xoma Health and XomaGuard that you want our listeners to hear?
Well, I think overall we have a great team that scientifically and engineering wise will be able to put this together. It working with our manufacturing engineering group, with our 2 people, it's amazing what we did in just the last 4 weeks. So we have a great team and we understand it. Secondly, we know we have a product and there's a definite need in the world community, let alone just here in the United States. We know that. It's so well documented, and they're all saying, as I said earlier, 97% of patients want a better alternative for the treatment of nighttime xerostomia. We believe we have that. And I think this is a win-win for not only us, certainly the patient, but also our distributors and our investors. I think this is just a win-win for everyone.
Yeah, I think so too. A great summary as well. When this is the question we ask every guest who comes on here, and I love that I get to ask this of you, just because of your experience and background, and how it's a little bit different than my normal guests on here. But what's some advice that you would give to Oklahoma entrepreneurs that are working in our ecosystem?
Well, number one, don't give up. To take a product from a concept to commercialization, there's probably not much in the world that's more difficult. Because one of the things that the entrepreneurs always do is they fall in love with their idea. And I always say, make sure that your product that you fall in love with, that will do everything for everyone, resonates out in the commercial marketplace. Make sure that you do enough internal and external work to ensure that the customer base really wants what you're designing and will pay for what you're designing. Don't make assumptions that the product will just be out there and everyone will buy it. I think you have to look at realistically today, how are you going to fund that road? Because it is not easy to do. And to do that, you have to really put together a well thought out, detailed, I call it cash management plan that I use, and a business summary or a business plan. And that's as much for the entrepreneur as it is for the investor. So you tell a story. There's a beginning, a middle, and an end, and it gives you a roadmap of where you think the company's going to go. And then does that roadmap resonate with investors or other people that you're bringing into your orbit? So it's a long process, and details, details, details on the business side are as important early on as what you're doing with your product.
I like the concept of building it for yourself, not just for investors or anyone else out. That's really strong advice.
Oh, well, I think it's so important because I've just seen so many investors and being a mentor that you ask some very basic questions and they don't have an answer. They have an answer about their product and what they think, but how it's going to get to commercialization is not well thought out sometimes. And so I really push for that roadmap.
Absolutely. Well, I said it earlier, I'll say it again. I think Xoma Health is very lucky to have you as their president. And I am also lucky to have you joining me today on the podcast. So thank you for your time.
Oh, it's my pleasure. I certainly enjoyed it. Thank you.
Yeah. And so for all of you that are listening, thank you again for joining us. You can hear from Randy himself on March 12th in Tulsa. So the OVF luncheon will be in Tulsa that month. So we're so lucky that we've been able to go back and forth between Oklahoma City and Tulsa and really support the statewide organization that Oklahoma Venture Forum is. To find out more information about XomaGuard and Xoma Health, go to xomahealth.com and you can learn more and find out as soon as they get that approval and make it to market. Thank you again for joining me.